The seasonal flu is caused by strains of viruses that have been around in the community for a number of years. H1N1 is a novel virus. It is a substrain of influenza A and is a strain for which most people have no immunity. There are vaccines available, but they unfortunately need to be administered in 2 separate shots. The vaccine available for seasonal flu is now pretty much readily available in the community and can be obtained through primary care physicians, the departments of public health in various towns, and I know that several of the drugstore chains have also been administering the vaccine as well. The H1N1 vaccine is now just being released through a variety of venues as well, and that will be available through the same network. It's important to get the flu vaccine because while influenza, the seasonal version of influenza is generally a mild disease, it is particularly prone to cause more serious disease in elderly people and in people who have various chronic conditions that might make them more susceptible to infection. On the other hand, the H1N1 infection seems to have turned this upside down a bit. Children and young adults, and in particular pregnant women, are all at much greater risk for serious disease than with the seasonal flu.
Okay.
No, you really need to be vaccinated for both, and they are, as I said before, separate shots that will need to be administered. They can be administered at the same time, but they do need to be administered separately.
Okay.
The flu basically seems to be like any other viral illness. It'll start out with generalized aches and just not feeling well, muscle aching as well, cough, fever, sore throat, and in some instances, gastrointestinal symptoms like nausea, vomiting, or diarrhea, but those are less prominent. Not necessarily. The fever could be really any degree of temperature elevation, and the disease in most people is very, very mild disease. But again, the opportunity for severe disease is greatly increased with the H1N1 strain compared to previous strains.
Okay, so
Stay home. The most important thing to do is to keep yourself isolated from spreading the disease. So you should stay home from work or school and minimize your contact with outside people and, in fact, people in your household. There was a recent article that was just published that suggested that hand washing and the use of surgical masks in the home help to prevent the lateral spread of disease in the home as well. So that even these simple things at home will help prevent other members of your family from becoming infected.
good flu season, right?
Hand washing, I cannot overemphasize how important hand washing is. And when we talk about hand washing, we're either talking about using one of the alcohol-based waterless hand cleaners or soap and water. When you use soap and water, it's really a good 20-second hand wash. It's not getting your hands wet and reaching for the paper towel.
Good advice.
There are 2 different vaccines that are available, both for the seasonal flu and for H1N1 flu. These vaccines are, the injectable vaccine is a killed virus vaccine. You cannot get the flu from a killed virus vaccine. The virus is dead. Both the H1N1 vaccine and the seasonal vaccine are made by the same technique. so that if one considers the seasonal flu vaccine to be safe, the H1N1 vaccine should be equally safe. In addition, there are very few reasons to not get vaccinated. A severe egg allergy is one, but there are very, very few others, other than people who may be allergic to one or more of other components in generally administered antiviral vaccines. The other vaccine that is available both for seasonal flu and for H1N1 is the nasal mist. And the nasal mist needs to be administered to people between the ages of 2 and 49. So if you're over the age of 50 or under the age of 2, it's not the right choice. That vaccine is an attenuated live virus vaccine. This means the virus has been weakened with regard to it causing illness, but it is still alive. So it is not the right choice for people who are particularly prone to infection or who have any diseases that might make it easier for them to become overwhelmed by infection.